A command center on prevention and control of novel coronavirus. Now we had this 12 press conference. Thank you all the media friends for your great interest in our work. In order to protect our journalists, and also we do not want to have a larger scale of public gathering. So starting from today, we will do this as a live streaming for our press conference and to release you the most updated information in a transparent, open manner and also answer the interest questions of the public. Today we have Madam Xiao Jihua, Vice Mayor of Hubei Province, Mr. Wang Wei, Head of the Technology Department, and Mr. Zheng Jinhua, Vice President of Shanghai's #1 hospital, and also the chief of the first batch from Shanghai to aid Hubei, and also the president of Jinyintang Hospital. Now I first give the floor to Madame Xiao to give you the update of the current work. Friends from the media, good evening. Since the outbreak of the novel coronavirus, General Secretary Xi Jinping attached great importance on the development of the virus and the rescue work and treatment of the patient. He made instructions on numerous occasions. The CPC Central Committee, State Council, and the military, and also the surrounding provinces attach great importance and give us great support. And also we had arrangement in this regard. And also we received the medical teams across China. Shanghai is the first team we received here in Hubei, and they depart the eve of China's Lunar New Year, and we received several batches of medical teams. As of 8 p.m. today, we received teams from NHC, the TCM Association, the Chinese Academy of Chinese Medical Science, and we received 68 medical teams, 29 from military, with total of 3,800 medical workers to aid Hubei. And we can tell the Ulsan, their medical elites. They from Department of the Infectious Diseases, from nursing, from the respiratory department and ICUs, and some of them also actually participated in the battle against Ebola or SARS. We're talking about the Shanghai, Guangdong, Zhejiang, Jiangsu, Sichuan, Tianjin, Shandong, and Chongqing, in total 15 provinces. They overcame a lot of difficulties because in their provinces also face quite severe tasks on prevention and control that still sent teams to support Hubei. After receiving training, the team from across China very soon in position to help us. And some of the team took over the inpatient areas of designated hospitals, and some actually took the job to cure the critical illness patients. And today, the Huoshenshan Hospital officially delivered to military. And the military sent 1,400 medics to shoulder the responsibility in Huoshenshan Hospital to receive and treat patients with coronavirus. That will help us to improve our capabilities. And academic Zhong Nanshan, Li Renjun, Tong Chen, Meng Xiaojun, Huang Luqi, and also the renowned experts. They came to Hubei and they live at the front line. They paid their utmost contribution and important guidance to our work at the front line. And all the medical workers, they work day and night, make their utmost efforts in the battlefield. Among them, they gave up the holidays, they postponed their marriage, and they also cut their hairs. Some of them also wrote down, "Call me anytime." And nothing can stop them. There are a lot of touching stories. And you also can see actually they have the marks actually left because of they wear the mask for so long time. We talk about when one side is in trouble, all sides are in support. This is also showcased the advantage of China's socialism with Chinese characteristics, and that also showed that Chinese people united together, and that also demonstrate the medical workers with boundless and universal love. And we pay our highest respect to them. Hubei will not fight alone. Wuhan is not an isolated place. They give us all the reasons that we will firmly and resolutely win the battle against the virus. I would like to take these opportunities to the State Council, CPC Central Committee, all the authorities, the militaries, and also our surrounding provinces. Thank you so much. And also to all the medical medics, thank you so much. Hubei, thank all of you. And Hubei with 60 million people appreciate your hard work. The municipal government attached great importance in the protection of our medical teams. And I also led a working team to make the implementation. So first, we would like to facilitate the life of our medics here in Hubei. So talk about their transportation, accommodation, as all in our consideration. Make sure that nothing can stop our medics or sleep their attention, so they can be fully concentrate their attention to cure the patient. And we also have designated cars for them, and we also have the channels. Make sure the suggestions from the front line can be very soon reach the top leaders. And we also paid several visits to the medics at the front line. We heard their reports and also conduct face-to-face negotiation and also help them to deal with the problems. Based on the requirement made by the command center, we established a working group and also have the designated person to provide the guarantee work to the medics from other provinces. We still have room for improvement. The medics from other provinces give great support, and also would like to say a big thank you and appreciate your understanding. And we will further make our work detail driven, and we do not want our medics to feel they're not treated well. And also would like to ask our friends from the media to observe our work. Right now, we're still at a critical situation, and with under the strong leadership of CPC Central Committee with Comrade Xi Jinping at its core, and a strong support from the authorities, ministries, and also the surrounding provinces. I believe nothing can stop us. We can overcome all different kinds of the challenges, and we will for sure win the battle against the virus. Thank you, Madam Xiao Jihua. Now the floor is open. Please identify your media affiliation. Renmin Daily. We talk about the military sent teams to aid Hubei, and also the other provinces also send their medical teams. I would like to talk about the arrangement of medical teams. Thank you for your question. Wuhan is the epicenter of the outbreak, and we have the highest confirmed cases. So we have a quite big pressure on prevention and control of the epidemic. Although we have sufficient medical resources. So the medical supporting teams first sent to Wuhan. As of 8 o'clock p.m. February 2nd, we had 57 teams with 6,775 members in 27 designated hospitals in Wuhan, including Huoshenshan Hospital, just delivered noontime today. To do a good job in Wuhan, also at the same time, the municipal government also attached great importance to the spreading of a virus in other provinces, because this really concerned us. So we talk about the imbalance of medical supplies and medical capabilities is also quite pronounced. So we had a quite heavy work need to be done at the rural or primary level. And based on the different situation and different places, we also arrange different medical teams to support the other places in Hubei. Right now, we have 11 medical teams with 1,553 members, sending to other places like Huanggang, Ezhou, Xiaogan, Xianning, Jinmen, Jinzhou, Xiangyang, Xiantao, Tianmen, and Qianjiang, in total 10 places. Huanggang is heavily heated places, so we had 2 teams with 549 members in Huanggang. This helped us to solve some difficulties we are facing in Huanggang, especially at the primary level. Talking about our next step, we'll base on the developing situation of the virus to better arrange our medical teams.
这个问题请王伟先生来回答。
谢谢记者朋友的提问。疫情发生以后，我省把诊断和治疗药物作为应急科技攻关的重要方向，目前取得了以下进展。在诊断方面，一是东湖国家自主创新示范区已有6家生物企业开发出了新型冠状病毒的检测产品，其中武汉华大基因科技有限公司2款新型冠状病毒检测试剂盒和武汉华大制造科技有限公司的。
For your question, I will give the floor to Mr. Wang Wei.
通过了国家药监局的审批。
Since the outbreak of the epidemic,
正在报审中。2是武汉病毒所和企业合作开发的2个抗体检测试剂盒已完成研发，开展生产，即将投入市场。该检测试剂盒操作简便，可避免操作者交叉感染。3是武汉大学中南医院通过改良核酸提取方法，使确诊结果的速度比以前增加1倍，最快2小时即可得出核酸检测的结果。在治疗药物方面，
passed approval by the National Drug Administration. The other 4 kits right now under approval. The Institute of Virology in Wuhan also work with other institutions.
和病毒致病机理的研究提供了支撑。2是目前已初步筛选出3种治疗药物，在细胞层面能有效地抑制新型冠状病毒的复制，其在人体上的作用有待临床试验。3是武汉病毒所对中科院上海药物所提供的6种化合物进行了筛选，发现 DC2、DC3 具备抗新型冠状病毒活性。这一发现将加快治疗新型冠状病毒肺炎的药物研发进度。4是结合我省实际情况，对现行诊治的中药处方进行了优化，拟定了肺炎1号、肺 肺炎2号药方和湖北中医大学分阶段诊治的处方，经过临床使用，取得了一定的效果。谢谢。
好，下面接着提问。
好的，我是湖北广电融媒体新闻中心记者。我想问一下，这个援鄂医疗队来自全国各地，有的医疗队接到
My question
任务后
regarding the medical teams from other provinces. So they quite in a rush to come into Hubei. So what kind of the arrangement we have and what we prepared for the medical teams? Thank you for your questions. We had more than 8,000 members from other provinces to Hubei. They actually asked for the mission, regardless the risk and also come death or life. So they didn't have time to say goodbye to their families and didn't have time to prepare for the trip. Because we talk about a team coming from all over the place in China, we need to do a good job to support them to have a quite a comfortable stay in Hubei. So we have done the followings. So near the hospitals, we arrange the accommodation for them and make sure they have a nice place to sleep in, and also to do the sterilization and ventilation, and to avoid the cross infections. And talking about, because they're coming from different provinces, we provide safe food for them, and also make sure they always have a hot waters to drink and also the warm meal to eat. Talking about transportation, and we allocated cars and make sure the medical teams have cars to transport between the dormitory or the hospital to their hotels. Talking about the securities, and we have the security people help them to protect them, and we also have the temperature screening and personal sterilization, and we also have the sanitizer at the cafeteria, and we also have the 3-tiered security system. And also based on the jurisdiction management, we have a specific team to support the medical teams. We have a team from southern places. They didn't wear much clothes with them. So the down jacket, the outer jacket sent to the group of medics. And that's also the donation from the public. And next, we will also detailize our work and make sure our medic teams can have a nice day here in Hubei. We talk about the Shanghai medical team. Actually, the first team arrived in Hubei. That's the eve of the China's Lunar New Year. And arrived in Hubei, and also the Jintang Hospital, because Jintang Hospital actually is the hospital with the highest number of infected or suspected cases. So this time, Shanghai government sent 2 teams, 1 nursing teams with total of 344 medics. With the first batch, actually, we departed at the evening of a Lunar New Year's Eve with 135, 38 doctors, 93 nurses, 4 people in charge of the nosocomial management, and we have 59 party members. Right now, we took over 2 inpatient areas with 60 beds and 1 ICU with 30 beds. After we entered to Jintang Hospital, we conducted the following works. First, we shoulder responsibilities after we arrived. On January 25th, we took over 2 inpatient areas and trained several times and mobilized all different resources. And we conduct our work in an orderly manner. At each patient areas, we're taking 3 shifts and strictly follow the guidance of treatment. And we also use ECMO to treat the patients and also do a good job in the local medical work, make sure there's no cross-infection happen among medics. We managed 268 patients, 41 with critical condition, 88 with serious condition, and 2 patients cured and discharged from the hospital on the 1st of February. We also established a party committee and the 7 branches. The party members always fight at the front line and shoulder their responsibilities, stay at the position, and we also have the members who would like to join the party and also apply their applications. And we also take care of our medics, the mental and physical conditions. And we also celebrate birthdays of our medics and also help us to be more united. Thank you. China Daily. And our Shanghai's medical team helped the Leishenshan Hospital run already 1 week and we'll see a progress. Talking about our first batch of medic teams, the local authorities and the Leishenshan hospitals attach great importance to take care of our medic teams, and they had quite a thoughtful arrangement for our medical teams and also have quite a clear requirements, and we also received the visits by the authorities leadership, and they also have the contact person. Leishenshan Hospital also help us to do a lot of work, make sure that we have enough the supplies in terms of work and life. So talking about the accommodation, transportation, we receive quite convenient service. We really appreciate their hard work. So I also would like to take these opportunities to clarify one thing. In the recent days, there is a rumor circulating the WeChat circle saying like we lack of resources. That Shanghai medical team actually didn't face this situation. So Shanghai municipal government also touched great importance in this regard. They mobilized the resources to meet our needs, and we have sufficient supplies. It's not true as the rumor circulated. The Leishenshan as one of the designated hospitals, what's the current situation there in terms of the patient administration? Now, I would like to ask Mr. Zhang Dingyu to take your question. December 29th, 2019, we received 7 patients with unknown pneumonia. Since this is quite a novel cases, and also we have the news regarding the seafood market. We didn't have a pathogen, but we gave the ALF treatment to our patient, and we sent samples to Wuhan CDC and TCM Association in Wuhan. And we tested the novel coronavirus in their samples. And coping with the increasing numbers of patients, and we right now have 21 patient areas to receive the patients with novel coronavirus. And we also receive the guidance given by the experts from provincial and the central level. And we also do a good job in terms of isolating medics and the patients. Right now, we have 581 patients hospitalized with 157 in critical conditions, 108 in serious conditions. Thank you.
请问湖北省是科教大省，在这次新冠肺炎阻击战中，我们在科研公关方面采取了哪些措施？谢谢。
Talking about the scientific research, what kind of update or progress were made this time? Thank you for your question. And based on deployment made by the command center, we had the experts and R&D institutes to do the DA research work and also to coordinate with the national team. And we also made the technical plan in terms of prevention and control of a novel coronavirus, and in terms of the vaccine and the medicine application. We also have the guidance. We're doing the following 4 jobs. Number 1, we established the working mechanism. We organized the Provincial Health Commission and the Leishenshan Hospital, Wuhan Virology Institute work together to do the development job. And we also have the academician as the consultant, and also have the 13 experts from cross-discipline to form the expert panel, and we'll also strengthen our work with the Ministry of Technology, make sure we share the information and we work together to make progress and the breakthrough in terms of developing the vacancy. And started the January 21st, so we also established the project to deal with the novel coronavirus. And we would like to increase the cure rate and lower the fatality rate. And we would like to speed up the development work and also to find out the vacancy and effective medicine and also the pathogen and epidemiology and other 4 areas. Third, and we give the support to the medics at the front line. We would like to strengthen our capability in treatment. That also do a good job to use the Western medicine and the TCM, and also educate the public, and also conduct the expert consulting services. First, we also open the green passageway. It's a case-by-case reporting system. And we also give the authority to the medics people, and they can conduct the sampling, collecting, and also the pathogen working, etiology and epidemiology work. Make sure they have enough supplies to conduct the lab tests and also have the transportation in place to facilitate their work. Now, let's ask the next question.
"谢谢记者的提问。疫情发生后，省委省政府成立了省新型冠状病毒肺炎防控工作领导小组，下设科技攻关组。科技攻关组由省科技厅、省发改委、卫健委、教育厅、财政厅、药监局、林业局等单位为成员组成，协调我省的优势科研力量。1月21日正式启动了湖北省新型冠状病毒感染肺炎的应急科技攻关项目。1月31日，我们又发布通知，紧急征集应急科技攻关项目，突出目标导向和应急需求，重点支持前期已有相关基础、短期内即可投入临床应用的技术和产品。应急科技攻关项目 由中科院武汉病毒研究所牵头，联合华中农业大学、协和医院、同济医院、中南医院、人民医院、湖北中医院、武汉金银潭医院、湖北省疾控中心等单位共同承担，协同攻关。目前，应急科技攻关项目取得了明显进展。
To now, we made a remarkable progress. First, we shortened the time of identification, and we also have a PCR kit, and we improved the kit, and that's also for the nucleic acid test. A kit will play a more reliable result for the detection. And second, we're talking about the clinic performance. The Wuhan Union Hospital right now also conduct their research on the clinic performance, and also help to provide the support. So we have a different clinic practice right now at the front line, and also make analysis and summarize of the therapeutic treatment plan. And third, we look at the new coronavirus may be a genome sequencing is 96% as the genome sequencing of bats. And we also conduct the different technologies to help for the genome sequencing, and also help us to shorten the time of the laboratory test. And we also finished 7 whole genome sequence testing, and we successfully separate the strain of virus. This play a key role for us to develop the effective medicine to cure the coronavirus. Based on the epidemiology and the therapeutic treatment plans, and we work with the WIV and also the Wuhan Health Commission. And we also work on the serum of patients to find out the antibody. And we find the different ways to conduct the work under the epidemiology. Thank you. So Jinyintang Hospital received the patients with critical conditions or severe conditions. So the medics at the front line, they work under a big pressure was the conditions right now of our medics at the front line. Thank you for your question. We had 834 medics, 700 at the technical posts, and of the supporting team is 3. 1 from Shanghai, and we have another team from Fujian with 137 members, and also we have the 40 members from the TCM Association, and also have a Tongji Union Hospital and other hospitals. They also send their teams to support the Jinyintang hospitals. Within the Hubei province, we also signed the experienced nurses with 135 members to support our work here in Jinyintang hospitals. And we also received from Shanghai, Guangzhou, Anhui, Hunan, Hubei, and nursing personnel, total to 200 personnel. And they largely help us to relieve the burden and also help us not work under a big workload. So the medics at the front line have time to rest a little bit and provide a better service to the patient. So the care job like sending water or the delivering the food, all be conducted by the nurses. For the patient cannot take care of themselves, and the nurses will also help them to wash their bodies and also take care of the daily requirements and needs. And they work really overstretching, but they complain nothing. They work in a quite challenging situation, but they really in a high morale. We, together with the medics from other provinces, we work together to fight against the virus. We never feel we're alone. We feel people and our country is backing us. Thank you. Due to the interest of time, one last question. My question goes to President Zhang. So what's the situation of patients in Leishenshan Hospital? Because we know your situation and your wife, we also quite would like to know the current health condition about you and your wife. Thank you for your question. I know patients in Leishenshan Hospital, under the guidance given by the experts from provincial and central levels, we give the treatment to follow the fourth edition of the guidance, and we give the different therapeutic plans based on the different cases and different situations. Some of the patients and will also use the in vitro supporting facilities. And we will also give the antivirus, anti-inflammatory, and other ways of treatment. For the first group of experts assigned by NHC, the Changbin from the China-Japan Friendship Hospital also gave us the support and will also conduct the first clinic study. Right now, just from the clinic doctor's observation, the medicine seems to be effective, especially for the patient at their early stage, that can help us to stop the symptoms from the mild to the severe or critical condition. But we still need to wait for more support. Right now, we talk about the remdesivir. That's an article surrounding online saying this is a quite effective medicine, but talk about side effect that really cause the way like the vomiting, the diarrhea, and also talk about the others, the symptoms. So it's not really the perfect fact. It still need to be improved. So the remdesivir also need to think about how it will work with other medicines. So it's suggested that you should take the medicine under the doctor's prescription. My wife cured and discharged from the hospital. So myself, I work normally, a little bit slowly in walking and in climbing the stairs. Others, I'm fine. Thank you all for your care. Thank you for asking. And that does for today's presser. Thank you all the guests, and also thank you the journalists. And that's the end of today's presser.